Thank you for talking with us today about this new partnership. And first, just wanted to understand, how did this partnership come about?
Yeah, so we've always had a long-standing good relationship with Holly Hill. And when their new CEO came on board, she proactively reached out to me as a stakeholder and said, hey, you know, let's talk about ways that we can improve services for our consumers and ensure that those who have mental health concerns, issues, if they need an intervention, that we can provide the best services for them. When I heard that, I was like, yeah, we're on board, because we know we have a large population that has mental health concerns. And so to have a CEO approach me proactively to say, how can we better partner? How can we strengthen the partnership, was just amazing.
And how exactly will this work? I know the news release mentioned working with Acorns and transporting directly to Holly Hill, but could you explain what that looks like?
Yeah, so just sitting down and talking through this, what we envision this to be is, one, that we're working very closely with Holly Hill, and that when there is a transport or there's an individual that needs to have an IVC, that we are communicating that with them, they are communicating with us, and then we integrate like our Acorns unit. That can be that those individuals that can transport to Holly Hill, or if one of our officers have to transport. As long as Holly Hill know that we're coming, we can communicate that up front, and then we can make sure that the transition is smooth once the consumer arrives at the Holly Hill.
And typically an IVC requires an exam by a medical professional, right?
Yes. Once the individual is, the consumer is, the IVC is granted, then yes, they would be evaluated by a mental health individual or a physician.
And so now would that evaluation, rather than happening at an emergency department, it would happen at Holly Hill?
Yes, that is the intent, and certainly they can speak more to that on their end, but we are happy the fact that emergency rooms are not inundated, because we're constantly having to take individuals who have an IVC to the emergency room. Being able to have options, other places to take them, that helps free up the emergency room, but also gets that critical care that the consumer needs.
And the hospitals, the emergency rooms, was this a problem that they came to you with and said, we need help on this? Or, you know, how are you interpreting that there was an issue with overcrowding at emergency rooms?
Yes, so that they did come to us, had a meeting with some of our local hospitals, medical centers, who indicated that they were seeing an influx of individuals coming to emergency rooms because there was nowhere else for them to go. That continues to be an issue in our region, in our community, and not just in the Raleigh area, but I'm sure nationally we're seeing that, as we are seeing more people in mental health crises. And so again, just being able to have a facility where they can go and get more immediate care is wonderful. It's a win for the entire community.
And would this be for juveniles and adults?
The services that they provide is for teens and adolescents as well, juveniles, yes, and adults.
Okay. And have you seen our reporting on Holly Hill?
I have not seen the reporting. I have heard about the reporting, but I have not seen it.
And so we've done a number of stories about complaints about Holly Hill. We've spoken with more than 70 people who have gone to the adult facility, the child facility, who worked there, who had loved ones there, expressing serious concerns about the kind of care they get there. Does that give you pause in partnering with them?
Mm-hmm. It does not, because the reason being is we have new leadership in place. And again, that leadership has reached out to us proactively. We have sat down, they have spoken to us about their plan to really revamp some things at their facility, which I think is promising and encouraging for those who are in mental health crises and need help. So I feel confident that moving forward, that we have some things in place, that Holly Hill has established some policies and procedures that's going to be beneficial to the community and those in crises. In the era that we are in now and the limited resources that we are seeing across all spectrums, knowing that there is a facility that's willing to help people in need is very positive. It's something that I feel that we need in our community.
And despite the complaints that we've heard, do you feel confidence that when a Raleigh police officer drops an individual off at Holly Hill, that they're going to get good care?
Mm-hmm. I do. I feel that you know, they have made a commitment, and we've made a commitment as well to collaborate with them. And so in speaking with their CEO, I know that they're bringing on additional staff. They're bringing on people who are well trained to be able to provide those services. I can't speak to that level of care because that's not my field, but I do feel confident that they will do the best that they can based on what they have shared with me to provide the best services that they can.
And in partnering with them, that implies an endorsement to some degree of what will happen at those facilities, right?
For me, what I can tell you is that we want to partner and collaborate with a facility that says that they're committed to providing care for individuals. That is important to us. We want to make sure that our community is healthy, that they're safe, and that there's resources out there for them.
And what kind of funding, if any, was involved in this collaboration?
So there's no funding on our part. I don't know what Holly Hill kind of funding that they have contributed, but there's no funding. We are continuing with the same partnership that we have had before with them.
And then the city, in terms of this coming together and happening, did RPD have to get any approval from the city at any level?
No, this is a continued partnership that we have had for many years. Nothing really changes with that. Nothing changes necessarily with our processes and our procedures. We still follow the procedures that we had in place, with, like for instance, with an IVC and a transport, and then turning the consumer over at Holly Hill. So all that is the same. Nothing needed to be changed, or no additional approvals need to be granted for that.
And just to make sure I understand, the issue that you all are trying to overcome is overcrowding in emergency departments, and after hearing from local hospitals that they were having a lot of mental health cases that would be better served at a mental health facility, then Holly Hill approached you all and you thought that was a good synergy and opportunity to alleviate some of the strain on emergency rooms?
Yes, absolutely. But not only that, we go beyond that. We want to ensure that they're getting good care, that members of our community who are in distress can go somewhere where they can get care. And if Holly Hill is able to provide that, that's a win for the entire community.
And what if they are not able to provide that? Are you open to that possibility?
Well, certainly we will assess and see how things go, but I have no indication to believe that they won't provide the best care that they can.
Gotcha. And then just to help me understand, so if there's someone experiencing mental health crisis, maybe it comes in as a 911 call, then Raleigh police respond with Acorns and with a Holly Hill liaison, or?
Well, if we get a 911 call in which somebody's in distress, we have officers in the field who are CIT certified, crisis intervention team certified. In fact, over 400 members of our police department are trained in that. So our officers have that basic knowledge where they can intervene, where they can assess, where they can de-escalate a situation. But also too, our Acorns unit, those officers on the Acorns unit, those social workers, they listen to the calls, they monitor those calls, and if there's an opportunity for them to intervene, they do that. They can help transport the individual, they can calm situations until we can get them to greater help or assistance.
And how long has this partnership been in the works?
Yeah, so we have been in partnership with Holly Hill for years, since the inception, since the opening of their hospital and facility, and we value that. We want to continue that partnership and continue working with it.
And then this new program, though, when did you all first start discussing that?
So I met with the CEO probably 2 months ago when she first arrived, and I don't know that she had just first arrived. She did reach out to me for us to meet, and when she laid out kind of a plan on what they're doing with Holly Hill, I said that's something I think we should partner and continue to partner with.
And of all facilities that RPD could have partnered with, why Holly Hill? Is it just because they were the ones that reached out to you? Well,
partly, but also too we partner with other places in our community. Wakefield, WakeMed services, any facility or any place that is providing care for our community, we want to be a part of that. So it's not just isolated to Holly Hill, it's other partners within our community as well.
And then just to give you the opportunity, we have already heard from some people after the news release came out who are really concerned about your partnership with Holly Hill and see that as a troubling sign. What is your message to them?
My message to them is that I think we should look forward to the future. We should look forward to a stronger partnership than what we have. I feel confident that the new leadership that's in place at Holly Hill is making changes. They're doing what they can to make that facility a better, viable facility, providing services that are much needed in our community. I think we need to give them a chance. I don't think that we should just think that because you might have had a negative incident before, that's how it's going to be moving forward. I'm willing to see how the relationship goes. We can make assessments from there, but I do feel confident that we're going to see a better brand of service moving forward.